Human crown is full of elevations and depressions. Okay, so whenever you see human crown, you see there are elevations and some there are depressions. So we'll see what are these elevations and depressions. So if you see the elevation, so what is elevations? Is any pointed, elevated or mount present on the crown surface of a tooth is called as crown elevation. So you can make out here, these are the elevations which are present on the crown surface. So this is known as crown elevation. So there are various types of elevation which is present on the crown. If you see, there is a cusp, there is a tubercle, there is a cingulum, there are ridges. Ridges are different types of ridges: marginal ridges, triangular ridges, transverse ridge, oblique ridge, cusp ridge, and inclined plane. Inclined plane is considered to be a slope along with the ridge, but still that is elevated, so it's considered under elevation. And then you will see the mamelons which are present on the crown. So what is cusp? If you see the cusp is a elevated and usually pointed projections of in various size and shape present on the teeth, which is, you can make out here, there is an elevation. So these are known as cusp, which is present on the crown, even on the occlusal surface. So they forms a bulk of our occlusal surface. If you see, it starts from here and ends here. So this total portion is forming the bulk of the crown of the tooth, and even for the posterior teeth. So anterior tooth do not show the presence of cusp except a canine. So only the canine has one single cusp, that is why it is called as cuspid. Otherwise, if you see anterior tooth till canine, lateral and central, they doesn't have any cusp. So single cusp is present on canine, so it is called as an cuspid. Premolars show usually two cusps, so they are called as an bicuspid. Molars shows more than two cusps, so they are called as multicuspid. So example, in the posterior tooth, the name of the cusp is according to their location. If it is on mesial side, this is mesial side. So if it is on mesial side, so this will be called as mesial cusp. This will be a distal cusp, distobuccal cusp, and this will be the distal cusp. So they are located, or name of those cusps are according to their location. So lingual side, lingual cusp; buccal side, it is buccal cusp; distal side, it is distal cusp. And clinical significance. So what is the clinical significance of this presence of this cusp? So if you see the clinical significance, they are mainly in relation with the opposite tooth. So whenever there is a opposite tooth is there, then only they are in the function. So what is their function? Is to break down the food into a smaller pieces. Then proper cusp alignment is important for the maintaining an even bite and preventing the dental issues. So when there is an occlusion often with an upper tooth, they are supposed to maintain the even bite. Okay, so that prevents the dental issues. If it is not in the even bite, so definitely there will be a food lodgement, there will be a temporomandibular joint problem will be there. So they has to align with each other with the upper arch or a antagonist arch. The well-formed cusp distribute forces evenly across the tooth, minimizing the risk of damage. So whatever the forces are present on this tooth or occur on this tooth during mastication, they are evenly distributed on the tooth. So if there is a force only on one side, so there are chances of fracture. Okay, so this cusp distributed the force evenly on the tooth and minimizes the risk of damage. Then tubercle. What is tubercle? Tubercle is a rounded or a pointed projection found on the crown of the tooth. You can make out here, there is a rounded portion here. Okay, so these portions are known as tubercle. They are not normal or a common finding. So this supposed to be not in the development of the tooth. When it is abnormal tooth development is there, then only the tubercle may form on the occlusal surface of the tooth. And they are also variable in sizes and shapes. So this may be smaller in size, or this may cover the whole tooth surface. Usually smaller than the cusp. So whatever the size of the cusp is there, they are usually smaller than the cusp. And even the location is most commonly on the lingual surface of anterior tooth, and especially on the deciduous tooth. So they are most commonly seen on the anterior tooth as well as on the deciduous tooth. And the permanent teeth, if you see, they are rarely common. But here the tubercle is present on the premolar tooth. So what are the clinical significance of this tubercle? So they can cause disturbances in the mastication and occlusion. So now if you consider this tubercle present in the mid of the occlusal table, so it will not match with the antagonist tooth. So it will hamper during mastication and the proper mastications will not be there. Then coming to the cingulum, what is cingulum? Cingulum is the large rounded eminence on the lingual surface of the permanent teeth. You can make out here a prominence, okay, or eminence on the lingual surface of the teeth of all permanent tooth. Okay, especially on the anterior tooth. It covers entirely cervical third of the lingual surface. If I divide this crown into three half, so it is present. This is incisal third, this is middle third, and this will be cervical third. So cingulum covers the incisal third area. What is the clinical significance of the cingulum? The cingulum protects the periodontal tissue from injury caused by the hard food, because if any hard food, if you are chewing any or cutting any hard food, so definitely it will be get prevented from the cingulum, and it prevents the periodontal ligament beneath the cervical area. It also strengthens the cervical enamel and also to help the absorb the forces and from the cusp when chewing. So when chewing, they protect the forces to transmit on the or a fracture of an enamel. Then cingulum provides support and resistance to the tooth surface. Removing the cingulum can significantly weaken the tooth and make it more susceptible for the future damage. So it provides support and resistance for the tooth during mastication. So by mistake, if doing construction of the tooth or while fabricating a tooth, if you have not maintained the cingulum properly, so there are definitely chances of the future damage to the tooth. Then coming to the ridge. Ridge. What is ridge? Ridge is usually a linear elevation. You can make out on the mountain here. They are the linear and usually convex elevation. So this is convex because there are depression on either side. So this is the convex elevation, but in the linear form. You can make out the line here. Okay, this is present on the crown of the teeth. So they are named according to their location. So the different types of ridges are marginal ridge, triangular ridge, transverse ridge, oblique ridge, and cusp ridge. So total five ridges are there on an occlusal surface of the tooth. So coming to the first, marginal ridge. So what is marginal ridge? Again same here. The linear elevation which is found on the mesial and distal end of the occlusal and the lingual surface of the crown. Now if this is an posterior tooth, so it's on the margin here. Okay, so this is present on the margin. So this is mesial side, this is distal side, end of the tooth, mesial end and the distal end. So elevation, you can make out the elevation over here. So those are known as the marginal ridges. They are less prominent on the anterior teeth and more prominent on the posterior teeth. You can make out on the posterior anterior tooth also. This part, these are the elevated area, these are the fossas here. Okay, so in anterior teeth, the location differed from the occlusal surface. They are present on the lingual surface on the lateral margin. So you can make out on the lingual surface as well as on the lateral margin. Okay, so this red part is a lingual fossa, this is a cingulum, and these are the marginal ridges. Okay, and the central is called as lingual ridge. So again, the name of these ridges are according to their location. So if there is mesial marginal ridge and the distal marginal ridge, so this will be mesial marginal ridge and distal marginal. So even in this also, this is mesial marginal ridge and this is distal marginal ridge. So what are the clinical significance of the marginal ridges? The marginal ridge has ability to resist occlusal load and maintain the structural strength. So these maintain the structural strength by resisting the occlusal forces. It has ability to resist functional and parafunctional occlusal load without damage. So they takes up the functional, that is in mastication, parafunctional, some abnormal forces. Okay, so they takes load without damaging the crown of the tooth. It provides structural strength to the crown. Even if it is not there, so definitely fracture can occur on this area. So definitely they are maintaining the structural load. Okay, they're giving the structural strength to the crown. food lodgement is prevented. Here they can prevent the food lodgement. The marginal ridge should form in two planes meeting at very obtuse angle to prevent the food lodgement. So because they are making some obtuse angle here, so that is why the food lodgement is prevented. And preserving the marginal ridge in restoration improve the fracture resistance. So while restoring tooth, if there is a cavity on this side, if you have not maintained this marginal ridge, so definitely there will be a chances in your filling. So this is what is clinical significance of the marginal ridges. Then coming to the triangular ridges, again the ridge is a linear elevation which descends from the cusp tip to the posterior tip towards the central surface of the occlusal table. So mainly if you see triangular ridges are present on the posterior tip, it starts from the cusp tip and it comes toward the central area of the tooth. In cross section they appear triangular in shape. If you take a cross section of this ridge, they will appear triangular in shape, hence called as triangular ridges. The name of these ridges are according to their location. Again, triangular ridges of mesiobuccal cusp, triangular ridge of the mesiobuccal cusp. If this is buccal and this is lingual side, so this will be triangular cusp of mesiobuccal cusp, triangular cusp of distobuccal cusp. This will be a triangular cusp of mesiolingual cusp, and this will be distolingual cusp. And what is the clinical significance? Same thing here. It provides and stability and strength to the tooth and its cusp to withstand the masticatory forces. So it gives support and strength and stability to the cusp to maintain the masticatory load. Then transverse ridge. What is transverse ridge? The combination of two triangular ridges. Now there were triangular ridges. This is a combination of the two triangular ridges which transversely cross the occlusal surface on the posterior tooth. So it's a combination. Now this is the triangular ridge and this is another triangular. So it's a combination. So an imaginary ridge, because here there is a depression, but it's still an imaginary ridge which is running transversely from buccal surface to lingual surface. Usually merge with each other, but may be separated from the groove pattern here. So it is simply union of two triangular ridges, one from the buccal and other from the lingual side of the occlusal table. So what is the clinical significance? It provides strength and stability to the tooth and its cusp. Now oblique ridge. It is a special type of transverse ridge which runs obliquely on the oblique surface, occlusal surface of the maxillary tooth. So it is running obliquely. It's a special transverse ridge. Okay, transverse ridge which runs from the buccal surface to lingual surface. This is also running from buccal surface to lingual surface, so it can be a part of an transverse ridge. But only thing, it is not going straight, it is running obliquely, so that is why it is called as oblique ridge. It runs from mesiopalatal cusp to the distobuccal cusp because it is only present in the maxillary tooth, not in the mandibular tooth. It runs from the mesiopalatal cusp to distobuccal cusp. So this is palatal side, this is buccal side. So mesiopalatal to distopalatal. So what are the clinical significance here? It provides strength and stability to the tooth and its cusp. It is important for chewing process because there is a big central fossa here, and that is why it is very important for the chewing process, and it resists the diagonal forces. Okay. Then cusp ridges. Now if you see the single cusp, okay, so single cusp will have four ridges. Okay, so each cusp has a four ridges extending in the mesial, distal, lingual and the buccal direction. So now consider this cusp, it has a four direction here. Okay, so the four cusp, this one cusp will have these four ridges. They vary in size and shape and even sharpness also. They may be round or they may be pointed or they may be sharp. They include triangular ridges also. This is triangular ridge, so these include triangular ridges, and the name according to the direction they run. So from where to where they are running, their name also located or given according to that. So if you see here, mesial cusp ridge of the buccal cusp. Now these are the buccal cusp and this is the palatal cusp. Okay, now see here, mesial cusp ridge. Now the mesial side of this side is this. So this becomes the mesial cusp ridge. This becomes the distal cusp ridge. This becomes the buccal cusp ridge, and this is the triangular ridge or a transverse ridge. Okay, so this cusp has a 4 example. Then coming to the inclined plane. Now these are the inclined planes are the sloping area found between the two cusp ridges. Now these are the cusp ridge, even this is the cusp ridge. So these are the sloping area which is present on each cusp. So one ridge will form two inclined planes. Now consider this central ridge or transverse ridge. It has a two inclined plane. Okay, so one cusp ridge has formed two inclined plane. Each cusp exhibit four inclined plane. So if this is a cusp, so each cusp will incline. So now have a four inclined plane. This is 1, 2, 3, 4. Okay, so one cusp shows four inclined plane. Again, the name of this cusp ridge has been according to the location. So what are these locations? So distobuccal inclined plane. So this plane is a distobuccal inclined plane of buccal cusp ridge. Mesiobuccal inclined plane of buccal cusp ridge. Distolingual inclined plane of buccal cusp ridge. And mesiolingual inclined plane of buccal cusp. Okay, so this is how the example of the inclined planes. So what is the clinical significance here? The inclined planes are used in dentistry to correct the variety of dental issue. What are these variety of dental issue? Can be corrected by the inclined plane. So inclined plane can help to correct an anterior crossbite by directing the bite forces. Anterior crossbite means, so normally if you see the anterior tooth, lower anterior are behind the central incisors, upper central incisors. Okay, but if there is sometimes what happens, the mandibular incisor comes forward often to the maxillary incisor, so those are called as crossbite. So these can be corrected by the posterior inclined plane. An anterior inclined plane can treat class 2 malocclusion by decreasing the overjet, redirecting the mandibular growth, and forcing the mandible forward during the swallowing. So before that, you should know what is class 2 malocclusion. Now if you see here, normally what happen here, now maxillary, the mesial cusp, mandibular mesial cusp should lie in between the first molar and the second premolar. So it's supposed to be here. Okay, it's supposed to be here, but now it is not there. Instead of in this position, it is little behind. Okay, so what is in between? The maxillary buccal cusp is in between the premolar and the first molar. So this is called as class 2 malocclusion. So you can make out here. Okay, so it is retrognathic jaw, right? So jaw has coming backward, not in the center line. So that makes a malocclusion. So that is known as class 2 malocclusion. So this is how the normal supposed to be. You can make out here the first buccal cusp of the mandibular first molar supposed to lie in between the maxillary second premolar to the in between the second premolar and the first molar. So if you see now, the jaw has been corrected here. Okay, so this is what is a class 2 malocclusion. So this has to be corrected by this inclined plane. You can make out the cuspal inclined plane. So this inclined plane can helpful in the correction of the class 2 malocclusion. Now next is a mamelon. So what is mamelons? Mamelons are the round, small projections of an enamel surface at incisal ridge is known as mamelon. So these are the round protuberance which is present on the incisal edge of the tooth. Especially newly erupted tooth are known as mamelons. These are found in various size and number. Especially they are dependent or representation of the lobes also. and normally worn off soon after the eruption due to its function. Now once you start in function, so they will disappear. So what is the clinical significance? This helps to break down or break through the gums considered to be during eruption and align properly in the dental arch. So they help in break down the gums and align properly in the dental arch in the initial stages or just after the eruption of the tooth. Now coming to the crown depression. So these are the depressions is the valleys. Okay, so which are the valleys present on the occlusal table or maybe on the lingual surface of the tooth. So there are different types of depressions on the crown surface: fossa, pit, groove, fissure and sulcus. So we'll come to know one by one. What is fossa? Fossa is an irregular rounded depression or a concavity on the crown of the posterior teeth. You can make out here irregular rounded depression or a concavity on the crown. So they may be present on the lingual surface of the anterior tooth. So large shallow depression on the lingual surface of the anterior tooth. So anterior exhibit a single fossa, posterior exhibit more than two fossa. So you can make out single here, other may be here, other may be here. So posterior have varied numbering of a fossa. They are varying sizes and shape. Here there is a squarish shape, here there is a rectangular shape or maybe a diamond shape. So you can see the example here. This is the lingual fossa or occlusal fossa. So you can call this as an lingual fossa and this as an occlusal fossa. So what are the clinical significance of this fossa? It allows food movement. So within this fossa they allows food movement, but they are very prone to caries because of food can lodge in between this fossa. So they are prone to dental caries. The developmental lobes does not coalesce properly. It can result in a deep invagination in the groove area of an enamel surface called a fissure. So this is what is a groove area. So this can form if they are not coalesced properly during the development. These lobes are not coalesced properly, so it can form a fissure over here. So what is pit then? Pit is a pinpoint depression present on the occlusal surface of the tooth. So these are the pinpoint depression. You can make out here pinpoint depression which is present on the occlusal surface. So they are varying numbers. So there may be one pit, there may be two pit, or there may be four pits. They are mainly responsible for caries initiation due to difficult to clean that area. Because of deepest area on the occlusal surface, food can get stuck over here and it is not easily brush up with the any bristles. Okay, so that is why they are very prone or responsible for the caries initiation from these points. Grooves from various sides joins to form a pit. Now these are the grooves which are joins to form. Now this side groove and this side groove, if they were the joints, there is a formation of pit. So the name of this pit are according to their location again. If you see mesial pit, so this will be the mesial pit of this crown, this will be the central pit, and this will be the distal pit of the crown. Then what is groove? Groove is a linear depression which is present on the crown of the tooth. So this is linear depression which is present on the crown of the tooth. Linear is running in a line. Okay, so there are often two types: developmental groove and supplemental groove. Developmental groove, also known as primary groove. Developmental grooves are also known as primary groove. It denotes junction of the primary parts or lobes of the crown. So each cusp forms from one lobe. So it's a junction of these lobes. It extends from mesial to distal direction and away from the central to buccal and lingual direction. So it joins or it's run from the mesial side to the distal side of the crown and buccal to the lingual surface of the crown, and it meet in the central point here. Okay, so again same here. Examples are the central groove. So this is what is a central groove, and this is what is a lingual groove and the buccal groove. So developmental grooves is a central groove which is running from the mesial pit to distal pit, and buccal groove which is running from central pit to the buccal side, and lingual groove which is running from central pit to the lingual side. Supplemental grooves, they are also known as secondary grooves. Now these are the primary grooves which you have seen here, but you can make out some depressions over here. Okay, not clear, but these depressions, these are actually a supplemental groove. They are also known as secondary grooves. So this bigger one is a primary groove, and these are the supplemental grooves. You can make out here also. These are the supplementary grooves, and they are auxiliary grooves, branches from the developmental grooves. So developmental grooves have giving auxiliary branches. Okay, these are the supplementary. They are not deep as the primary groove. So you can make out here, these are the supplementary, not the central grooves. Okay, not the developmental grooves, but they are accessory or auxiliary to the developmental grooves. So what is the clinical significance of these developmental grooves? So again, they are the depressions here, so difficult to clean away the food and the bacteria, which can lead to tooth decay. Grooves can trap a plaque and calculus. So if the food get lodged in between these areas, so this becomes either plaque or a calculus, so which can lead to the destruction of the periodontal ligament. So again, why there will be a destruction of the periodontal ligament? Because this area will get raised. Okay, wherever there is a presence of plaque or a calculus, so area will be raised, and there will be change in the masticatory forces. Okay, so if any abnormal forces on the tooth, parafunctional forces on the tooth, will damage the periodontal ligament. So when preparing the tooth also for restoration, the groove has to be modified. Now if I want to prepare this tooth and remove this groove, so I have to prepare according to the grooves. So I have to modify these grooves and should not allow any presence of the grooves after the restoration. Now coming to the fissures. What are the fissures? A fissure is a deep pit or a groove in the tooth surface, often found on the chewing teeth. That means the molars. Now you can make out this yellow part, the total yellow part, which is having a depth. Okay, those are known as fissure. It's a uniform, little broader. Okay, including pit and grooves. The fissure can be narrow, making it difficult to clean them with the toothbrush or water. So again, same here, there are different types of grooves, or sorry, different types of fissures here. You have a V-shaped feature, you have a U-shaped feature, you have an I-shaped feature, and IK type of an feature, okay, of the fissure. And this create an environment where bacteria can grow and become prone to the tooth decay. So this is how you have to modify the fissures. You can make out these fissures. So you have to, so depression from this point to this point, this is known as fissure. So you have to modify this feature, and you have to remove the decay from this area, and you have to seal. So this is known as fissure sealant. So we have sealed these features, okay, so that food lodgement, chances of food, the pit is not exposed as well as the groove is not exposed. So if the pit and grooves are not exposed, so definitely food lodgement will be less in this area. So that is why you can use pit and fissure sealant. Okay, those are known as sealant. Sulcus area now. Sulcus is a shallow depression. So sulcus is a shallow, again in the linear form. Okay, so it's a shallow linear depression on the occlusal surface. Okay, so this is shallow but linear. It runs from this to this area again along with the groove. So that is why they are known as sulcus. The incline of which meets form groove. So this incline of this and this incline of this cusp forms a groove here. Okay, or a junction of these inclined planes forms the groove in the sulcus area. So from here this triangle forms the sulcus of this tooth. What is the clinical significance of this sulcus? The tooth elevation along with the depression assist So this is overall clinical significance of the elevations and depressions of the tooth. So tooth elevations along with the depression assist in the food breakdown into a smaller pieces. So elevations as well as depressions. Okay, if the elevations I consider for the upper tooth, I will have to consider depressions of the lower tooth. Okay, so to in combination with these two, they break the food. They maintain upper and lower jaw relationship so that your teeth or a jaw will be in proper rest position. It maintains the facial structure as well as aesthetic, because in proper relation, so they maintain the aesthetic. They maintain the temporomandibular joint. If you put forward your lower jaw, so definitely there will be a strain on the temporomandibular joint. So they keep the relationship of the upper jaw and the lower jaw, maintains the temporomandibular joint in a sound position. The tooth depression such as grooves and pit can indicate areas where the dental caries may be more likely to occur. So that means these areas are prone to caries. So anyone have to identify the caries area. So we can put the probe into the caries or into the pit or a fissure, so that indicates the presence of caries.